office. It was told I'm working in a private office, and I have written a book, All Ceramics and CAD/CAM, at the Quintessence Publishing Company. This is my staff here. We have only a small practice, very small. I'm a lucky guy. This is all my family. This is my father. He's 77. He works as a dentist. And this is my daughter. She's 21, and she's in the third year studying for dentistry. So I believe I'm a really lucky guy, and we have a big family tradition in this. So this is the entrance of the office, and you can see here I have started with the CAD/CAM technology in a very early stage, but I hold all these machines. It's a little bit like a museum. Meanwhile, okay, this is a treatment room, and you can see the CAD/CAM plays a role everywhere. This is here in this room. I tried to combine the CAD/CAM technology directly with the treatment measures. We are mainly focused in aesthetic dentistry. And aesthetic dentistry, you will see it during my lecture, is not for me not to replace amalgams with composite. I believe we are doing really aesthetic dentistry, and I hope I can show you this a little bit. The professional hygienic procedures also play a big role, of course. Here, once again, CAD/CAM, all other digital technologies like the DVT here, or the functional things, work with laser, and a little bit implantology too, especially then when it has aesthetic reasons to do this. So this is not the lab. This is some things for CAD/CAM procedures directly in the office, but not only CAD/CAM. I have a little fable for the dental technology things too. But the real specialist for the dental technology is my dental technician. I should tell you his name. He's Kurt Reiche, and he has made all the nice things you can see during the next hour in my lecture. This is the lab here, and if you have in your mind a picture of a dental lab, maybe it looks like this, but our lab is completely different. I can show you. This is a look in our lab, and you see we are working with different CAD/CAM technology. And if I would have seen such a picture like this 20 years before, I would think this is NASA control, ground control in Houston. But this is a dental lab here, and we have a lot of young people who are fascinated by technology and working there. So I'm connected a little bit to the CEREC technology, so I founded this CEREC Masters Club in Germany, making a lot of lectures all over the world. This was for instance, in Tokyo last year. Now I'm in Dubai. Once again, it's a great pleasure for me. Now let's start with the lecture, and the question should be, we are talking about beauty, and we're talking about aesthetics, and is it possible to create beauty and aesthetic with a machine? Can help us a machine to create such things? Here you can see a picture of a nice restoration. I hope you enjoy it, and the things, maybe it is different from a lot of other restorations, is you will not see it. And for the patient, it doesn't matter. But this restoration is completely done with CAD/CAM and digital technologies. Here's the initial situation. Here we start the preparation, and then This clinical situation was scanned, and we did the construction of all these things with CAD/CAM technologies. And also these models here are not doing with the classical impression. These models are doing by rapid prototyping. We never take an impression for this patient. And so the restoration is produced here, and it's finished, and it looks like this, and this can be a very big success, and maybe it's the future. The question is, when we talk about beauty and we talk about aesthetics, this is a very a thing of passion, of feelings, and how can this go together with a machine? So let's have a look how this can work. But let's start with a practical example. This is a failure. This is a new crown. It's not 1 year old. The patient is a young lady. She's 19, and this was a sports accident. But it is easy to say, this is a failure, it is not good. But let's have a short look, what is not good. And so we found some things we don't like. At first, this crown does not respect the outer form of this. And also, it hasn't the characteristics of the natural teeth. And the surface structure, look, this is rough, this is smooth. And last but not least, it isn't the same color, it's too dark. So, from my point of view, we have 4 very important things when we want to have success with our aesthetic treatment. We must respect and we must reproduce this. We must have the right form and size. We must do the perfect characterization of this tooth. We must give the surface the same structure from the other teeth, or the surface we decide that we want to have. And last but not least, we must have the right tooth color. So, how can we manage this with the help of the CAD/CAM machine? At first, and this is a very interesting thing, it starts maybe 1 year ago with the last IDS, we have this possibility for intraoral scanning. We scan, we don't work with the classical impression, we scan. And we can do this for documentation and communication. Every case we start not only with an X-ray and the clinical examination, we make an intraoral scanning. And if I want to communicate with the lab in this problem, I don't need a model. I can send him a file and he can have a look. So then with this scanning and this data, we can do 3-dimensional analysis of such cases. We can manage with the help of computer, and I've told you that it's very important. We can manage the form and the size of the teeth we want to restore. We can do the surface characterization, but it is limited. I will show you this in the lecture. And we have increasing possibility for the production of thin structures too. In former years, it was very difficult to mill very thin structures, but it is the question of the time. We should be minimal invasive, and we should have the possibility to produce very thin structures. And one thing is backwards planning. This is a big word. Now we can be sure when we start a treatment and we have a treatment plan with the help of backwards planning, we can be sure that we can reach what we promise the patient he will get, and this we do with the help of backwards planning. This is the intraoral scanning